Hello, I'm Dr. John McDougall. In the news these days is the discussion of precocious puberty. That means children who are growing up way too early. And we find in our society that little boys and little girls, they're maturing 5, sometimes 10 years before intended. That's right, let me give you some of the statistics. Little boys and girls are supposed to mature when they're 16, 17, 18 years of age. That's the time to start thinking about and having babies, not before that. But because of the rich Western diet, the dairy, the meat, the high protein, high oil foods, what happens is we encourage the production of sex hormones, and as a consequence, our children are maturing earlier. For example, we've found that the average onset of puberty in a little white girl is around 11 years of age, and a little black girl in our country is around 10. And we find half of the black girls in our country are going through puberty at age 8, and 3% of the black girls are going through puberty at age 3. That's because of the food. Now, when you take and you cause the onset of maturity early, what happens to little kids' thinking? They're not thinking about checkers or bicycles or schoolwork anymore. What are they thinking about? That's right, they're thinking about sex. That's natural and normal. They start thinking about, about sex with other kids. And what does that lead to? Well, that leads to the chance of pregnancy, venereal disease. It leads to children stopping their education because they have to get on to familyhood. I mean, it's a disaster for the family, for the person, and for our society to have children mature and start thinking about sexual thoughts 5, 10 years before they were intended to. Well, we can change all that. We can change all that by nourishing our children properly. That's right. A child who lives on a starch-based diet with minimal amount of animal foods and extra oils in their diet, they'll mature when it's time to mature. They'll have babies when it's time to have babies. You have disruption going on in your home. Well, it's not too late. You can change it now. I mean, change the kids' diets. That'll put them back on a time clock they should have been on a long time ago. I'm Dr. John McDougall. Thanks for listening.